We're going to talk about heart health and being heart healthy out there. That's so important for you, ladies and gentlemen, to be part of that conversation. Great to have back with us. I've got cardiologist Dr. Fahmi Farah on with us to talk about this, and she is one of North America's best cardiologists out there, and she's based in the Dallas-Fort Worth area. And, Doctor, it's great to have you back on the radio. Welcome to the show. How are you?
Thank you for having me. It's great to be back.
Well, thank you. Great to have you on board, and really appreciate you joining on the program. Was talking a few minutes ago about the arrival of cold weather that's going to be on the way. You and I are in the Dallas-Fort Worth area where it's nice and pleasant, 65 here today, but many areas of the United States are going to be experiencing extreme cold. We're talking about heavy snow, ice, freezing rain, just not good weather to be outside. And this, I would imagine, really does take a big toll on someone's heart health if they're not ready for it, right? The extreme cold. Welcome back.
You're right, especially in areas where they'll be experiencing heavy snow. Every year we get a lot of patients in the ER showing up with heart attacks after shoveling snow. So that is definitely something to keep in mind. Snow shoveling has to do, it causes a lot of intense activity, and so a lot of stress on the heart, especially for those folks who are not used to regularly exercising. It could be a dangerous exercise to take part in, and so I do ask that people be careful with that.
Okay, so we don't need weekend Supermans, right? That if you've not shoveled snow in a while, you don't want to get out there and be a Superman and try to do the driveway. Maybe hire somebody, maybe a young kid that can do that. But I think a lot of times, though, that people may say, well, I just feel fine. I should be able to go out and be able to do that. Would you recommend that maybe before the cold, snowy season, gets into place in some parts of the U.S., and maybe somebody go in and get an overall checkup, find out what's going on with the heart, with blood pressure, things like that, set the stage?
Definitely. Things that, like people who have pre-existing heart conditions already, such as they have blockages or congestive heart failure, they definitely need to have pre-checkups like before winter months start. And even those who have risk factors for coronary artery disease, like hypertension, high cholesterol, diabetes, they need to get checkups with their doctors regularly and make sure that they have refills and that they're complying with all their medications. Very important.
Well, when you mention congestive heart failure, what is that exactly? Is that indicating, what it sounds like right there, that your heart is simply just not working properly? Describe that. What is congestive heart failure for the listeners?
Yeah, you're actually correct. So, a heart is a pump, and its major function is to pump blood in and out of the heart. And so when it's pumping out, it's squeezing. And there's a number that we calculate to measure how strong that squeeze of the heart is, and that number is called ejection fraction. In a normal heart, that number should be between 55 to 65%. When we're talking about congestive heart failure, that squeezing ability gets less strong. So in other words, it gets very weak, and the heart just doesn't pump as well, and that is congestive heart failure. There are two different types of congestive heart failure. Some people could actually have the pump still function well, but still be in congestive heart failure where there's a relaxation problem of the heart. So just to simplify for our listeners, congestive heart failure just means your heart function, as you mentioned, is not well. It's not able to get blood in and out properly, and as a result, you'll have symptoms like shortness of breath, swelling of your legs, and just weak in general.
Okay, absolutely. And when you are mentioning the fact, like swelling of the legs, for example, a conversation with maybe the general practitioner or the cardiologist is really one of the most important things here, correct in that? Because maybe the cardiologist can then describe like a water pill, which I think is the way it's described, right? That it helps move the fluid along a lot easier.
You're right. Yes, yeah. For those people who have congestive heart failure and they're having lots of swelling and shortness of breath, the treatment is very important, of course. Like, you do need to see a cardiologist. And yes, a water pill can typically help take some of those fluids off. And it's not just water pill. There are several other types of medications involved in the treatment of congestive heart failure. And all those medications are very important and they're life-saving, not just by prolonging life, but also by increasing the quality of life, by making sure that the heart function doesn't worsen over time and that it gets adequate support to increase that function over time. And as far as swelling and shortness of breath goes, I will say one other thing, that is food. What you eat is very important for everybody, but especially for those who have congestive heart failure, because salt is your enemy. So in foods that have high sodium content, you need to watch out for those, because those will put you in acute heart failure for those who already have congestive heart failure, and can cause increased shortness of breath and swelling.
Okay, good thanks. And so would you also recommend, doctor, for the listener, for the drivers out there, to avoid like these energy drinks that have got maybe 400 pounds of caffeine, and I'm just exaggerating there, obviously, but that have got such an overload of caffeine that it could send the heart into overdrive with that amount of caffeine in the product? What would you say?
Yes, I would. Avoiding energy drinks, anything that has high amounts of caffeine, it's a good idea to avoid those. I typically tell my patients 1 cup of coffee is okay. I usually tell them to avoid things that have espresso in them, not to drink too many of those, because it's not just, and I just make clarify, it's not just for people with congestive heart failure, but people with, not everybody basically, even those who do not have congestive heart failure. It's a good idea to avoid too much energy drinks, because you're right, it can throw off your rhythm. It can have high heart rate, high blood pressure, and rhythm problems with that.
Yeah, will this eventually lead to maybe, what is the phrase, atrial fibrillation? Could that be maybe an extension of that? Could that develop as a result of all these things you're mentioning? Atrial fibrillation.
It can. Atrial fibrillation, just to define it, it's a type of rhythm problem where your heart rhythm kind of goes out of sync and the heart beats irregularly. And one of the biggest things we worry about atrial fibrillation is that it increases the risk of stroke, because atrial fibrillation actually causes blood clots to form in the heart, and that blood clot then can go to your brain and cause a major stroke. And so, yes, to answer your question, all those risk factors like high blood pressure, diabetes, high cholesterol, sleep apnea is one of them, and drinking too much energy drinks can exacerbate somebody's atrial fibrillation by increasing that heart rate.
Doctor, when people come in to see you, do they maybe mention the fact, well, gee, I didn't know I had this heart problem going on? Maybe can the symptoms be so severe that people just don't recognize that their heart is racing, or they may not understand or realize that they're getting tired much more quickly? Maybe some will chalk it up to just getting older. Is it an awareness situation, and most folks don't even realize that they've got these conditions?
That's a very good question, and it absolutely is. A lot of times it is an awareness issue, because majority of the people who have heart disease, they're asymptomatic until it gets pretty severe. Same thing with people who have heart attack. Majority of the people that we see in the hospital come in with heart attack, they actually never had any symptoms. They'll just all of a sudden have that heart attack, and that'll be their first warning sign. And that's the same way for majority of the heart conditions, actually. Same thing with rhythm problems. A lot of people who have atrial fibrillation, they don't know they have atrial fibrillation. We usually find it after they have a stroke.
And is one of the ways to maybe pick up on an irregular heartbeat, do you do an electrocardiogram, and I think it's called an EKG? Does that help you pinpoint what's going on there?
It can, yes. Electrocardiogram is a very simple test that can be done in the office, and it can catch AFib. If the person is having AFib at that moment, then yes, the EKG will catch it. The thing about AFib is that there's something called paroxysmal AFib, which means that it comes and goes. So it's not that the patient is always in AFib. So the time when we're getting the EKG, if they're not in AFib, we will not catch it. So we'll have to do additional testing for that.
My goodness. All right. And it's interesting when you're mentioning all of the tools that are available in the tool chest to help alleviate a lot of these concerns. Many of these tools probably were not around maybe 10 years or so ago, right? So it's got to be a good time to be in medicine because you're helping more people with more science, more medicine, more medication, probably seeing a lot greater success results maybe as compared to like 10 or 15 years ago.
Oh, I totally agree. Yes, medicine has changed dramatically, and technology is so great right now that we can help people and we can help pinpoint. The diagnostic tools are so much better, and same with treatments. We have really great treatments available, both non-invasive and invasive, where we can change the picture for our patients. And as you know, I always say this, that 80% of all heart conditions are preventable. And so coming in to see the heart doctor and getting that checkup early is so important because we can completely change the game.
Yeah, do you find, doctor, some of the patients maybe hesitant to come in because, well, I've heard this before, the doctor might find something wrong? Well, that's why you got to go to the doctor, right? Do you hear that?
I do hear that, yes.
Well, what do you say to that? There's somebody that's on the fence about that. What do you say?
Yeah, it is hard because there's a lot of fear, like that fear component keeps a lot of people out of the doctor's office. But what I have to say to you is that coming in and overcoming that fear and coming in will go a long way because we can fix it. We can totally fix it to where you can live a completely normal life, and the normal life expectancy that you would have had, even without that, if in a normal population, like without heart disease. So we can completely change the picture to where you'll be a normal individual. So that's how good our treatment modalities are now. So there's no need to be afraid. And things are very non-invasively done nowadays. So we don't really do that many invasive things. Like if you get there early enough and things get caught at a timely manner, we can make changes even with simple medications to where you will not even need that open heart surgery.
Yeah, goodness sakes, a friend of mine, he is a medical information officer for MedStar, and he has told me on the air that one of the great tools they've got is technology on board the truck on their ambulances that relays the information about the patient all the way into the emergency room where the doctors there, cardiologists, are going to be ready to go, waiting once they get there to that location. So it's an amazing demonstration of the fact that technology is really making great strides in helping keep people safe. Doctor, got a break for just a few minutes. Got to do the commercial thing. And ladies and gentlemen, you're more than welcome to join me in the conversation. Jump in if you want to talk about heart health and heart healthy awareness. One of the best cardiologists in North America on with me, Dr. Fahmi Farah, is on. And she's here to answer any questions you've got, not diagnose you over the phone, obviously, but to give you that little additional information you can take back to your own doctor and let them start the process of getting you better. Drivers, have you ever experienced like a racing heartbeat when you're out there on the road? You just know that your heart is going 90 miles an hour. One of North America's best cardiologists is Dr. Fahmi Farah. And, Doctor, again, thank you very much. As always, I do want to get the website out where folks can read up on you, find you, and reach out to you. Where can I go? What's the best way?
You can find me at www.drfahmifarah.com. Also, I have a new podcast series out with all sorts of health information, and that's called Queen of Hearts Podcast. You can find it on YouTube. My handle for all social media is at Fahmi J. Farah.
Okay, very good. Thank you very much for joining us on the show. And we were mentioning the fact we're going into the really cold weather season coming up around the corner. Many parts of the U.S. north of, say, Kansas City, Omaha, getting snow already, and many people are unfortunately going to get sick. They'll get a cold or a flu. And I was thinking about this during the break. We were mentioning like the energy drinks that you consume will accelerate your heart. And if someone is going to be taking an over-the-counter cold remedy or flu solution or something designed to make them sleep, can that create some problems with the heart. Are there ingredients in some of the over-the-counter meds that could accelerate the heart rate?
There are some cough syrups and nasal sprays that can cause your heart rate to go up a little bit, and same with blood pressure, that can cause your blood pressure to be elevated. In general, generally speaking, for the most part, the over-the-counter cold medicines are safe. But for those who have pre-existing heart conditions and are on medications for those, you should run it by your cardiologist or your primary care physician.
Okay, very good. And the pharmacist, right? Don't forget about the pharmacist behind the counter. They're also a great source of info, and they can probably answer all of that directly for you as well, can't they?
They can, absolutely.
Okay. And again, it's that information source that you really got to try to get right to the heart of, ladies and gentlemen, because you've got to be very much in the know and aware. Doctor, many of the listeners that are out there, they'll be out there for long stretches of time, and many will get sick on the road. They'll be in their sleeper cab trying to sleep through a cold or maybe the flu season, and we talked a little while ago about the importance of wiping down counter surfaces and things like that to make sure everything is staying clean. Any recommendations that you might have for the drivers that are out there, that if they are indeed caught on the road, they're sick on the road, and they need to get into an ER, maybe something's going on with their heart rate, or they just don't feel well, what would you recommend for them to do? Where to go?
I would say, first of all, for those drivers, long-distance drivers, always have a first aid kit with you with just some simple medications like aspirin, for example. Aspirin sometimes can be life-saving in the setting of a heart attack. If you feel like you're having a heart attack, we typically tell all our patients that, just chew up 325 milligrams of aspirin, just chew it up, and that can a lot of times prevent a full-blown heart attack from coming on and save somebody. But beyond that, I would say the best thing to do is to call 911, because if you truly are having a heart attack, if you're in a remote area, they may need to send actual help like EMS or even helicopter, because when it comes to heart attack, time is life. It's a very time-sensitive thing, so I would not wait around. I would actually call 911 right away.
Okay, absolutely. And, I think one of the other maybe things to do is that maybe have a buddy system in place. Say a driver feels like they're really ill. Maybe have a friend to phone, call 911, have a friend to phone, have that support system in place, right? If somebody feels like they're going through like a heart attack situation. Who to call?
Yes, yes. I think that's a very good idea to have that support system in place.
Okay.
And, you brought up the winter month. We spoke about it a little bit earlier. I'm just going to take this opportunity to say a few other things. During the winter months, we also have all the holidays that come up. One of them is coming up next week, Thanksgiving.
One minute.
Yes, and these are the times when a lot of people tend to get into trouble, and we see a spike in hospitalization with things like heart failure or heart attack. And part of the reason is because people become a little bit non-compliant with medications because they are distracted with family members or traveling. So I would say pay attention to that and be sure to take your medications.
Outstanding. Doctor, thank you very much. Really appreciate you getting on board and sharing the information with the listeners out there. All across North America, Dr. Fahmi Farah on the line with us, and one of the best cardiologists in North America. Reach out to her, ladies and gentlemen. Questions, she will certainly be able to help you. Doctor, thank you very much, and let's do this again really soon. I've got to wrap up the hour right here on SiriusXM 146.